Abdominal organ pain receptors are not sensitive to pinching, burning, cutting, electrical, or thermal stimulation. Mechanical pain receptors are in the serosa of solid organs. Rapid stretching or rupture of the capsular surface of a solid organ can cause pain. Owners of animals with sudden splenic rupture and bleeding, either into the splenic parenchyma or into the abdominal cavity, often describe their pets making a sudden yelp and suddenly lying down. The patient may show acute vomiting or anorexia for several hours or days after the episode, if they survive it. Patients with abdominal pain may struggle or resist palpation or transducer pressure. They may also show a tucked up or arched back appearance, abdominal splinting, or place their sternum on the ground with the rear quarters in the air. When placing your patient in dorsal recumbency and stretching it for an ultrasound examination, watch for signs of abdominal pain or discomfort. Removal of the diseased or traumatized spleen will relieve the symptoms of pain. Patients with chronic stretching of the splenic capsule will also show abdominal pain. Patients with multicentric lymphoma, including splenic involvement, often present with anorexia and lethargy due to chronic abdominal pain caused by stretching of the splenic capsule. Removal of the spleen will not cure the lymphoma, but will often relieve patients' symptoms for several weeks or months. This video is from a 9-year-old Scottie with splenic hemangiosarcoma, but no abdominal effusion. Fine needle biopsy is a relatively easy and less expensive method of obtaining more information about smaller splenic masses or lesions. About 50% of the time, I do not find it necessary to sedate the patient for fine needle biopsy of the spleen. As discussed in the liver DVD, fine needle biopsy results are reliable about 50% of the time. Reports of neoplasia are usually reliable. The technique for fine needle biopsy is described and demonstrated in the FAST exam DVD. If the spleen and splenic lymph nodes are enlarged, which should be biopsied? Ideally, both would be biopsied. If cost becomes a factor, I suggest always biopsy the spleen first. Lymph node biopsies sometimes yield a result of reactive lymph node, a nonspecific finding that is not helpful. Surgical or laparoscopic biopsy are the most reliable forms of biopsy. I feel that a large splenic mass that has ruptured or presents a danger of rupture should be surgically removed and then biopsied.